Thank you, Chaitra, and the other chairpersons. Mine is not really an innovation in the true sense, but since there was some interesting aspects of Dr. Lalit Verma wanted to include me in this presentation. So we all know the challenges of diabetes in our country, and the problem is on screening, how it cannot be done just limited to only ophthalmologists, but has to be extended to other people, especially the physicians and the diabetologists. And I've been talking about this in all the forum possible, where the owners of screening should be with the physicians and diabetologists, because they are the people who see the target population. For the last almost 15, 17 years, we have been doing this opportunistic screening, putting a fundus camera in the physician's office or the diabetologist's office and having their patients' fundus photos taken, and through tele-screening, we have been screening these patients. We call it as opportunistic screening. But there are challenges in it, is to get the trained manpower, a standardized way of grading, and the time delay in the grading to be done. So we started in 2004. I was looking for some of the activities where AI could replace, because it was then that the AI was coming in. We were working with a lot of educational institutions, engineering institutions, who came up with the idea of working on AI especially in diabetic retinopathy. But very often all these attempts ended up with just writing a paper of identifying a yellow spot or a red spot, and it stopped at that. So there was no way we could get, even in glaucoma we have been trying to do, but this has not seen its fruit. So when Google came up with this proposal, we immediately jumped in to see how we could, because as a company we would definitely see a product which will be useful in ophthalmology, and that's how we started working with them in 2013. Of course, Shankar Netralia, Dr. Rajiv Raman also was part of this attempt, and we have been working together with the Google team to develop these earlier algorithm, and also to test these algorithm in the real-time scenario. Our paper is yet to be, the paper that's comparing our and Essence data is been accepted at JAMA, but yet to be published. But in the previous studies, it showed a very high sensitivity and specificity, which made it very useful for this purpose. So it's a very simple thing. You just drag and drop the image, fundus image, into the tool, and it automatically predicts within a few seconds whether the patient has got a mild, moderate or severe diabetic retinopathy, or even the level of diabetic macular edema is predicted through this. So we've been using this as an assisted read in all our screening programs, because it's yet to have a certification like FDA or the CE certification. I believe the CE certification is there, but just reached, but not yet. We have not done it as an independent read, which we will soon do it. So today we are using the ADA, also assisted by the human grading, to generate a report and seeing how well the ADA is working in these situations. So soon this will be replaced. But what is important or interesting to note is some of the outcomes of this study done by Google, where they saw that the 5-year cardiovascular risk factor was being predicted by just the fundus photos, and even the gender of the patient was being predicted at 97% accuracy, age of the patient, HbA1c, diastolic and systolic blood pressures, and these are to be validated. These were just some of the outcomes that they saw during the analysis of these papers. So we hope that with soon we'll be able to use this not just for diabetic retinopathy, but also conditions like glaucoma, AMD, in primary care settings where the ophthalmologists are not available. At least the triaging the patients will be much easier if you have these automated systems. So use of these could improve the current ophthalmological assessment in many places, and we hope this will happen soon so that we can reach more people.